here in Rhode Island, Governor Gina Raimondo has issued an order now requiring workers at many businesses to wear masks. Today, the governor announced 275 new cases. Rhode Island now has more than 3,000 confirmed cases.
Unfortunately, another 7 people have passed away from COVID-19 complications. The state's death toll is now at 80. The health department says 3 of the 7 lived in nursing homes and another was in a group home. After a slight decrease yesterday, the number of people in the hospital has also gone up, now to 213.
Eyewitness News reporter Kim Kalunian joins us live from the State House with what else was discussed today. Kim?
Well, Shannon and Mike, if you've been paying close attention to the numbers, you might have noticed a slight decrease in the number of new daily cases that are being announced. But today, the director of the Department of Health, Dr. Nicole Alexander-Scott, says that has more to do with the holiday weekend and yesterday's severe weather and less to do with a reduction in the virus.
I do want you to maintain your vigilance. The stay-at-home order is still in effect.
Governor Gina Raimondo asking for people's patience and cooperation, reiterating Tuesday the local economy will not reopen with the flick of a switch.
We all need to start to realize that for the next year or so, we're going to be living under a new set of regulations.
A new normal, she says, might require the continued use of things like telecommuting and masks.
These masks will not prevent you from getting the virus, but evidence suggests that if you wear a face mask, it could reduce your ability of spreading the disease to somebody else.
The governor dialing up her recommendation to wear face masks and making it an executive order effective Saturday. Starting then, all workers at public-facing businesses like stores and pharmacies, as well as offices and manufacturers, will have to wear masks on the job. Employers must provide them to their workers, and customers will also be encouraged to wear them.
I'm also sure many of you are saying, I'm not going to do that. That's weird. It feels funny. I look stupid. I don't know if it helps anyway. And to you, I am saying you have to do this. You have to do it because it's going to protect everybody else in Rhode Island.
Dr. Nicole Alexander-Scott says people should wash their masks frequently, at least once a day, and ensure they properly cover their nose and mouth.
You should not be using a cloth face covering as a reason to go out into the community with symptoms. It is not acceptable and it's not effective.
Raimondo says the state will start doing unannounced spot checks this weekend, and penalties and fines will be implemented if necessary.
It's something that I need us all to get used to because it will prevent each of us from spreading the disease to those around us.
And if your business needs some help getting masks, we have a link to resources right now on our website, WPRI.com. So you might be wondering, where is my mask? It's right here. I do wear it when I'm not on camera. The governor says she does the same. Now, coming up tomorrow, the governor's press briefing will be at 2:30 instead of the normal 1 o'clock. We will still bring it to you live right here on WPRI 12 and on WPRI.com. Live at the State House, I'm Kim Kalunian, Eyewitness News. Well, Shannon and Mike, today the governor talked a little bit about contact tracing. That's the process they use to try and find people who have been exposed to the virus to attempt to stop or slow the spread of COVID-19. Now, right now, this is a manual process, lots of people making phone calls and the like, but the governor says she wants to try and use technology to automate it. Today, she gave us a little bit of insight into where things stand.
Over the course of this month, actually in the past 14 days, we've reached out to more than 2,800 people who've been in close contact with someone who has the virus. So that means we're reaching out to about 200 contacts a day, and in some days it's 400 or 500 contacts a day. In this regard, contact tracing, as with testing, Rhode Island is ahead of many other states. We have a team now, we have a team of nearly 100 people focused on nothing but contact tracing. They do everything from calling contacts to coordinating with counterparts across agencies. We've been able to successfully reach 3/4 of all contacts on our first attempt, and by the second attempt, that number goes up to nearly 90%. It is our goal to make it so that very soon people are allowed to have an electronic app where they're surveyed especially if they've been positive, they're in isolation. They'll be surveyed several times a day, each day, electronically about their symptoms. We'll have an ability to stay in touch with people. And it is our goal now, we are to be in touch with everyone who tests positive within hours, and we hope to get that from 10 hours to 6 hours to a few hours, be immediately in contact with folks who are positive, immediately in contact with those contacts, and then constantly in contact with the sick people every day. So it's been a Herculean effort by the Department of Health, now augmented by the National Guard. It is very manual and labor intensive, and they're doing a terrific job.
And the governor also acknowledged when it comes to using technology that can sometimes bring with it privacy concerns like those raised by Republican reps and senators here in Rhode Island today. The governor says she believes those concerns are valid, but she also wants people to know if they do use the app, they would have to opt in to these programs. Live at the State House, I'm Kim Kalunian, Eyewitness News.